Has it ever happened to you that you get that little ringing in your ear? That horrible beat you just can't control? Sometimes it comes and goes. Sometimes it's there all the time. Sometimes even with headphones it won't go away, and instead of working comfortably and focused, you're just constantly hearing that noise. That's called tinnitus. And today, I actually brought you a wonderful doctor, Dr. Fidel Leon. He is an otoneurologist, a specialist in audiology and otoneurology, and he deals with these kinds of cases all the time. Doc, welcome to the channel.
Thank you very much, Dr. Federico. Audience.
Thank you very much, Doc. Tell us a little bit first about what tinnitus is. I already mentioned it a little, but what exactly is tinnitus? Why does tinnitus occur?
Okay, look, tinnitus, also known as ringing, buzzing, or whistling in the ears, is the perception of a sound that isn't actually present in the outside environment, right? There are identifiable causes, like the heartbeat, or there are causes that aren't so easy to identify, which is what most people describe. Just like you mentioned at the start of the video, when they say, "I hear a beep," it can sound like a motor, an electrical wire, a simple ringing, or a high-pitched yee. Tinnitus, well, generally, there are several causes, right? The most common causes of tinnitus are injuries at the cochlear level. The cochlea is part of the ear. The ear is divided into three parts: the outer ear, the middle ear, and the inner ear. The cochlea plays a very important role in the inner ear, especially when it comes to hearing. When there is an injury to the cochlea, it's common for the patient to experience tinnitus, or the other way around. You see a patient with tinnitus, you examine them, do a hearing test, and identify an injury at the cochlear level. That's the most common cause. Among these cases, people over 60 years old are generally the group that experiences tinnitus the most, right?
And can those injuries be caused by listening to a very loud noise? Or how do these injuries happen?
There are many causes, but the main one is noise, just like you said. Work-related exposure to loud noises, or continuous noise throughout the day. Overuse of electronic devices in the ear. Nowadays, it's expected that a lot of people will start losing their hearing in the coming years because of this kind of overuse, which became even more common after COVID, right?
Okay, we'll talk about that topic in a moment. And, for example, a blow or a fall.
A blow as well, what we call trauma, can cause an injury to the inner ear and lead to tinnitus. Also, using a firearm, a firecracker, or any very loud noise, what we call acoustic trauma, can also cause tinnitus. Even a simple earwax plug in the external auditory canal can cause an injury in the middle ear, a ruptured eardrum, or an infection, otitis, which can also lead to tinnitus. But the most common cause, let's say, is an injury to the inner ear.
Now, I know this is a really complicated question, but I've had tinnitus suddenly, and then it goes away. There are people who get it for a little while, and you say, yeah, I hear that ringing, and then it just goes away. Why do some people get it once or twice in their life, and then it disappears, like just for a moment? And why does it stay for others? Is there some kind of temporary injury or temporary condition? Or maybe I'm talking about something that hasn't been explored yet.
No, definitely yes. Yes, this has been very, very well studied, but it's something that's hard to answer. Most patients with tinnitus have intermittent tinnitus. That is, there are few people who have it all day or who hear it all day long. Most people with tinnitus hear it in quiet environments or when they're about to go to sleep. That's when it starts. Or yes, in less noisy environments, when they're in busy places, like a restaurant, a party, or just in daily life, they forget about it or get so used to it that they don't even notice it anymore.
Right. Maybe they don't hear it as much because they're kind of tuning it out, right? Now, is there any treatment for tinnitus?
Yes, obviously, if there's an identifiable cause, like an organic lesion, then there is a treatment. When there isn't such an obvious cause, what we call idiopathic, meaning you do all the tests and can't find anything. Of course, there can also be central causes, right?
Uh,
But something that really helps is tinnitus retraining therapy, when there's no observable lesion. Tinnitus retraining therapy involves listening to white noise, the well-known white noise.
Okay, how does that help?
That helps to mask, to make it compete with the sound the patient is experiencing. They're told, you're going to listen to white noise or white noise therapy, but the key isn't to mask the sound. The first time, you're going to pay attention to it and turn up the volume to match your tinnitus, so that your perception of the tinnitus is competing with the white noise.
It's like what headphones do that eliminate outside noise, that's end.
Yes, but it should be in an environment that's not really about wearing them in your ears.
Okay. Now, Doc, how common is tinnitus in young people, in men, women? Is there any relationship with gender or age?
Yes, regarding gender and men, both because of work-related exposure and also with age. Like I mentioned at the beginning, patients over 60 years old, obviously, as the years go by, there's hearing loss, right? And when there's hearing loss, it's an organic damage in the cochlea, and well, it's a very common cause. Also, as I mentioned, exposure to loud noises in young people, use or overuse of electronic devices or high decibel levels, in other words, listening at very high volumes, ends up causing damage, right? They're causing damage that can be an acoustic trauma.
Now, I don't know if you agree with me. I'd had many patients tell me that starting in 2019 or 2020, which lines up with the whole COVID thing, their tinnitus began. You know, since the pandemic, they always say, it's just that after the pandemic, after the... And then they start bringing up the vaccination topic. You know how it goes, right? They go straight to that topic. What could be a logical explanation for that, setting aside the idea that maybe COVID itself did invade some part of the ear, because a lot of people had ear infections along with COVID, right? It doesn't even have to be COVID. Even any cold that affects your ear can leave your ear damaged, right?
Of course, regarding COVID, what I've noticed is the overuse of electronic devices. In what way? Well, we spent more time on telecommunications, video calls, being connected, classes, students with headphones, and also the environment. Why do I mention the environment? Because stress and anxiety also play an important role in tinnitus. Not sleeping well. These are factors that can make your tinnitus worse, right?
Of course, right? And we were locked up in our homes for many weeks, and that can also cause stress like, what's going to happen? Am I going to lose my job? Loved ones who are at risk because of this disease. All of that caused enormous stress, right?
Terrible stress and anxiety.
And that can trigger not just tinnitus, but other conditions like vertigo, which we've mentioned in videos that I'll link here. Vertigo,
Perceptual dizziness.
perceptual dizziness.
Persistent.
Vestibular migraines. All of that could also have been triggered after the terrible stress we went through, right? All of them.
Of course, yes. Environmental factors, negative emotional impacts, anxiety, and stress all work against you with these kinds of conditions.
Okay. Doc, so can a patient with tinnitus really have a good prognosis if it's treated in time, if they get treatment? I mean, how many tinnitus patients actually get cured, and how many have to live with it for life?
Of course, it depends on the cause, okay? When there are identifiable causes, of course, there are even tumors in the ear, like an acoustic neuroma, which is a common tumor, or a glomus tumor, which is also something vascular. And generally, if you find a cause, then you treat it, right? But first you have to identify what's causing it.
Okay, so that's why it's important to see an otoneurologist to get checked out,
Yucky.
or an ENT, and have them do
An evaluation, when you have tinnitus, is really about figuring out what's causing it.
Do they always order an MRI, or what do they order?
No, not always. It depends. Mainly, it's a physical examination and otoscopy, the use of tuning forks, which maybe I'm getting into more technical, specialized tools from my field, and audiometry, and a tympanometry. There are a lot of tests, but it all depends on where the origin of the tinnitus or ringing seems to be coming from.
All right, very good. It's a very interesting topic, and it's very complicated to diagnose.
Not to diagram. Well, yes, it is complicated to diagnose, but sometimes when there's you can't find. It's tricky. I mean, I've had patients with tinnitus that I examine and I can't find the cause. And again, anxiety and stress seem to be the main factors, right? So we also rely on different management approaches.
It's like bruxism, you know? I see it like bruxism. Sometimes with bruxism, the clenching of the teeth, you usually find a physiological problem, right? With the bite, maybe the bite isn't right, or there's a wisdom tooth that's bumping into something and causing pain. But sometimes you look and say, okay, everything is perfect, the x-ray looks perfect, the bite is perfect, and yet the patient is still clenching their teeth. Well, in that case, we have to look at the root causes, like psychological issues, stress, anxiety, which, well, They cause a lot of illnesses or go hand in hand with other conditions, right?
Not sleeping well, insomnia. People who have tinnitus and don't sleep well or anything like that, it gets worse for them. It increases. All those behaviors, or rather, hygienic treatments, need to be followed.
And please, just to wrap up, do you have any recommendations for the audience to help prevent tinnitus from getting worse, or even to avoid developing tinnitus in the first place?
Of course, mainly for, well, for everyone, but especially for young people, it's about the use of electronic devices. When it comes to the ears, in-ear devices, listening to loud music for long periods of time will eventually cause damage. Try not to overuse them. Don't overdo it with either the time or the volume, okay? I was just reading an article yesterday that said, keep the volume of your device below 60% and use it for less than 60 minutes.
And for young people, for example, who often go to places like bars with really loud music, would you also recommend earplugs? I'm a musician, and I played for many years in places like bars and clubs. I had my own band, and we used to wear earplugs. We literally made them out of napkins, you know? That is, you put some napkins there. Why? Because it was really uncomfortable to be right next to the speakers. And if anyone asked us, what's that? We just say, they're earplugs. Why? Because it's really uncomfortable, you know? And I take care of my ears because we're musicians and you need to have a sharp ear. So, for those people who work,
Of course I get it.
in those places, people who spend the whole weekend there, it would be good and smart to wear some earplugs or just stay away from the speakers, right?
No, absolutely, 100%. There are protectors that reduce the sound by 30 to 40 decibels. And yes, you should use them, because if you're in an environment where the sound is really intense in decibels, and also for a long period of time, over time it's definitely going to cause you damage.
Yeah, and then, for us dentists, there are some handpieces, the old ones, the ones that made a ton of noise. Those also generate a lot of decibels. Now we have electric handpieces that are much quieter, and that really helps us minimize that kind of exposure, especially continuous exposure, right?
Exactly.
Kindergarten teachers with all the kids screaming too, that's really, really common. But anyway, moms, dads who are there with the kids and the little screams, those are important too. We need to check that.
Yes, of course. When there's tinnitus, the important thing is to determine the cause.
Awesome, Doc. Thank you very much. Dr. Fidel Leon, otoneurologist. Thanks for being here on the channel. Remember to subscribe. It's free. Information for you, for your health. Don't miss the videos we recorded about vestibular migraine. We also recorded a video about PPPD, which is different from crystal-related vertigo. It's another interesting type of vertigo. Check out those videos, they're good. Thank you, Doc. Take care, and we'll see you next time.
Thank you, Dr. Federico Beza, to you and your audience. Thank you very much for the invitation. Very good, okay.